Good afternoon, everyone. My name is Michael Kevinarji. I'm the Regional Director for the Midwest for the U.S. Department of Health and Human Services. It's great to be here with all of you. Today, we're here to talk about access to contraception in an increasingly challenging landscape. But first, I want to say a thing or two about courage, the strength to do hard things in the face of daunting challenges. You all have showcased tremendous courage in the wake of the Dobbs decision by not only continuing but ramping up your work to defend the right of women to make their own healthcare decisions. The work of the people here today ensures that we bear witness and use the strongest tools in our professions to document the impact of Dobbs on public health directly informs our ability to do policymaking. On behalf of Secretary Becerra, I would like to thank our panelists who will be speaking here today and the reproductive health community at large for coming together to move mountains for our country's women and girls. We have a great amount of respect and gratitude for all that you do, especially as you pursue this work through the lens of equity. Here at HHS, we're doing everything in our power to ensure women, especially those in states with abortion bans, can access the care they need. And we know that our work on reproductive justice continues to be critical for closing equity gaps. We've taken action to protect a patient's right to emergency medical services, to protect patient health privacy, and to ensure non-discrimination in healthcare delivery. Most recently, in line with President Biden's executive order on strengthening access to affordable, high-quality contraception and family planning services, we took action to make contraceptives available over the counter. The data show that the over-the-counter birth control pills, the first of which was approved by the FDA in July, will prove to be a crucial milestone in our mission to build healthier futures and close equity gaps. Right now, HHS, along with the Departments of Labor and Treasury, is seeking public input on how best to expand access to over-the-counter contraception and other proven preventive services. As you all know, when a person becomes a doctor, they're required to take a Hippocratic oath. They pledge to uphold the highest possible ethical standards in treating patients. The Dobbs decision is forcing providers to grapple with that oath because it comes in conflict with patient autonomy and the ethical principle to protect vulnerable groups. The Supreme Court's decision to overturn Roe had and will continue to have an immediate and irreversible impact on the lives of people across the country. We've heard from providers who are scared to provide the care they're trained to provide because of harsh penalties. We've heard from medical students and residents who are deciding to pick other specialties because of the Dobbs decision. We've seen that predictably the lion's share of impact has fallen on low-income women and women of color. And while we hear these stories, the folks here today are the ones that help us document and measure trends, impacts on providers, healthcare systems, patients, and communities. The high-quality work done helps us understand this complicated picture of the far-reaching impacts of Dobbs that informs our ability to understand what opportunities there are for action moving forward. Putting restrictions on people's ability to make their own healthcare decisions is un-American. It's regressive, and at its core, it's deeply unfair to both women and the providers who care for them. On behalf of Secretary Becerra, we appreciate you and all the women who are helping see the difference that your work makes. We look forward to hearing from all of you in just a moment, but for now, let me turn this program over to my good friend, the Director of the Office of Civil Rights for HHS, Melanie Fontes-Rayner.
I'm a little shorter than him, right? Okay. Good afternoon, everyone. My name is Melanie Fontes-Rayner. I run the Civil Rights Office at the U.S. Department of Health and Human Services. For those of you new to us, we are a nationally facing civil rights office. We also work on privacy protections for patients across the country. I'm really excited to be part of this event today and be a part of the work that you are all doing. All that you do on the ground is really the front door work, and you're really hearing and seeing the stories that all of us read about in the news or hear in stories. And that's what matters, and that's what pushes the work forward, and that's what keeps us moving forward in this space to make sure that our patients have that voice and our providers have that voice. I'm really grateful for the leadership of Secretary Javier Becerra and President Biden, who have really taken action here at a time when federal action is needed. As many you may or may well know, the President of the United States has signed 3 executive orders in reproductive health care space. That's unprecedented. And the department has taken a lot of steps to protect Americans and their reproductive rights, including the broad spectrum of health care, which we all know is inclusive of contraception and family planning services. We've made a lot of progress, but there's still a lot of work to do, and I'm excited to be part of this conversation and this work today. In the wake of the fall of Roe v. Wade, President Biden swiftly mobilized the U.S. government in ways I think none of us have ever seen. Being able to talk freely about abortion and reproductive health care, family planning care in a way that I think some of us have dreamt of, and making sure that it was front and center in the dialogue with American households across the country. The Executive Order 14101, strengthening access to affordable, high-quality contraception and family planning services, was issued just this past summer, where President Biden has directed the U.S. federal government to do all it can to build progress and bolster access to affordable, high-quality contraception across the United States and across U.S. federal agencies. Of course, the U.S. Department of Health and Human Services plays a critical role in that. As we know, we are tasked with finding ways to ensure access to that. Michael talked a little bit about the request for information that the U.S. government did to work on over-the-counter contraceptives and making those covered under our ACA plans and the plans that are covered under the ACA. We also know that we're working to say birth control is legal across the country. Birth control is health care. And you should be able to access it no matter who you are, where you live, or where you go. And this prioritization is really important because we know that these are really important decisions, right? The ability to decide whether, if, when, how to choose to have a family is a very personal decision, one that should not be restricted because of misinformation or because someone doesn't like that right in the first instance. This administration has worked tirelessly to make sure that Americans have access to accurate information. Given that misinformation is so prevalent and daunting, we've issued guidance to clarify protections for birth control coverage under the Affordable Care Act. We also launched a comprehensive website, reproductiverights.gov, a one-stop shop for accurate information for anyone needing information about reproductive health care that was up within minutes of the Dobbs decision last summer. The Affordable Care Act, we all know, has done a lot to make access to affordable birth control a reality for women across the country. Yet access to high-quality contraceptives continues to vary based on income, location, health insurance coverage, and availability of healthcare providers. And millions continue to face barriers. If cost is a barrier, we at HHS provide high-cost, high-quality contraception across federal health and human services. Through the Title X program, our HRSA federally qualified health centers, the Indian Health Services, among others. And we know the FDA continues to make decisions based on evidence, not politics, when it comes to reproductive health care. This includes approving the first ever oral contraceptive and clarifying the approval for emergency contraception in the first instance. And finally, my office, the Office for Civil Rights, has been strengthening privacy rights for reproductive health care, specifically reminding people of what is required under the law today, under current law with no changes, that the HIPAA itself doesn't require particular disclosures, they're permissive, but also we put out a proposed rule to make sure that that information can't be misused and that patient-provider trust is critical in preserving and protecting that so that we're able to treat patients as we are intended. We all know there's an overwhelming support of Americans across the country who support access to reproductive health care, including contraception, who utilize contraception to improve their lives and to improve their communities. And I'm thrilled to be able to support Cook County Health and taking another step forward and increasing this access to allow women and pregnant people to make decisions based on their family, their health, and their futures. So I appreciate the opportunity to be here with all of you, and on behalf of President Biden and Secretary Becerra, thank you for all the work that you're doing. At this point, I'm going to go ahead and turn it over to Katie Thiede.
Thank you so much. I'm Katie Thiede, co-founder and executive director of Illinois Contraceptive Access Now, ICAN, a statewide initiative to advance contraceptive equity by de-siloing, destigmatizing, and normalizing birth control as basic health care. We do this in 3 key ways. 1, by partnering with safety net providers to establish screening for contraceptive needs and desires as a routine part of primary and preventive care. 2, by advancing and implementing policies that make it easier for people to access contraceptive care, such as the new HFS Family Planning Program, which you'll hear more about in a minute. And 3, by engaging patients to make sure they have the information, tools, and resources necessary to make informed decisions about their sexual and reproductive health care and to demand the right to high-quality care. In the wake of the Dobbs decision eliminating the right to abortion, millions of people are routinely being denied their right to make their own decisions about their own bodies and their own health care. And while much of our collective effort and focus has rightly been on protecting abortion access, we must also acknowledge that equitable access to person-centered contraceptive care is fundamental to reproductive autonomy. At ICAN, we hear from patients every day who don't know where to go, who to trust, or if they can afford their contraceptive care. Even in Illinois, a state that leads the way in defending and advancing reproductive rights, people of color, people with low resources, and young people face persistent barriers to accessing the birth control of their choice. This is why we're so thrilled to have 12 of the leading safety net providers in Illinois as part of ICAN's Quality Hub Network. Erie Family Health Center, Howard Brown Health, Near North Health, Rush Adolescent Family Center, PCC Community Wellness, Heartland Health Alliance, Friend Health, Heartland Health Services, Promise Healthcare, SIU Family Medicine, Shawnee Health, and as of today, Cook County Health. By joining our network, these health centers have committed to providing same-day access to all birth control methods at low or no cost and to delivering person-centered contraceptive counseling to all patients of reproductive age. ICAN is also proud to have supported the Illinois Department of Healthcare and Family Services in establishing the HFS Family Planning Program. This new alternative Medicaid benefits program, through which an estimated 1.2 million people are now eligible for coverage of family planning and related services, is one of the most generous of its kind. We are grateful for the unwavering commitment of HFS leadership to ensuring that coverage under this program is comprehensive, equitable, timely, confidential, and flexible. Finally, I would like to extend my deepest gratitude to the U.S. Department of Health and Human Service Office for Civil Rights, the U.S. Department of Health and Human Service Region 5 Office, and Cook County Health for their support in planning and hosting this event. Their participation today is evidence of their commitment to transforming how contraceptive care is delivered, accessed, and paid for at a time when the stakes couldn't be higher. Now, it's my pleasure to introduce Israel Roca, Jr.
Good afternoon, everyone. Pleasure to be here with you. I'm Israel Rocha, the CEO of Cook County Health. We are honored to be hosting leaders from the U.S. Department of Health and Human Services, Director Fontes Rainier, and also Director Carmenargi as partners in the Illinois Contraceptive Access Now program. I'd also like to thank Cook County Board President Tony Preckwinkle, our Cook County Board of Commissioners, including Commissioner Deere and Commissioner Meller, who's joined us behind us, Vice Chair of the Health and Human Hospitals Committee, and then also the Cook County Health Board of Directors for their steadfast support in the work that we do to ensure that the residents of Cook County have access to the care that they need, and that includes contraception. Contraception is an essential component of an individual's health and well-being. It allows people to control their reproductive health and family planning. With this control, people, particularly women, are better able to take advantage of all opportunities that they would like on their choices and their terms. Cook County Health is thrilled to join the ICAN Quality Hub Network, which will support our existing efforts to provide patient-centered reproductive health services. In addition to learning what other participants are doing in the network, we expect that the participation will also support greater coordination among our providers, improve experience for Cook County residents, and reduce barriers to access to care. Joining ICAN's Quality Health Network for contraceptive care is aligned with our historic mission of ensuring that healthcare access for all patients, regardless of their ability to pay, their insurance, or immigrant status, is fully available to them. Our investment in family planning services has expanded over the years to providing contraceptive care at all our health centers across suburban Cook County and the city of Chicago to improve access to those who need it close to home. This partnership is about brick building with ICAN to make sure that we're adding information to our services, our availability, and what supports we have for our potential patients and existing patients who may not be aware of the breadth of services that we offer or collectively offer to them. I'm grateful to Dr. Alicia Patel, who will expand on what we do and how that is so valuable to our patients. It is important for us to find external organizations that align with our mission and vision so that we can share the quality of work that we have been doing and how we're able to bring more information to patients, care services to them on terms that they require. For our organizational standpoint, this partnership also allows us to dive deeper into the data to ensure that we are providing care services to the people who need it and that we're reaching out to those who need it most. Despite Illinois being a leader in reproductive care services, a study by ICAN showed that only 1 in 5 women were counseled about their birth control options, and about 500,000 people in Illinois do not have coverage for birth control. Cook County Health has long believed that reproductive health care is a basic part of health care, and we truly believe that health is a human right. We are proud to partner with organizations that promote this work and allow individuals to have full access to their entire spectrum of care, including contraceptive care, so that they can live their healthiest life. Now I'd like to say a few remarks in Spanish. La anticoncepción es un componente esencial de la salud y el bienestar de una persona y la que permite controlar su salud reproductiva y planeación familiar. Con este control, las personas, particularmente las mujeres, están en mejores condiciones para aprovechar las oportunidades que ellos quieren en su vida. Cook County Health está encantado para ayudarse con Quality de ICAN, que respalda nuestros esfuerzos existentes para brindar servicios de la salud reproductiva centrales a los pacientes y nuestras mujeres en nuestro cargo. We are so happy to be here today. It is a true partnership. Cook County Health fully supports the work that ICAN's doing, and we look forward to learning, expanding, and bringing more services to women so that everyone can live their healthiest life. I am now very pleased to bring forward Dr. Alicia Patel, our Associate Chair of Obstetrics and Gynecology, and also Chair of our Family Planning Services here at Cook County Health. Dr. Patel.
Good afternoon, everyone. Thank you for having me and allowing me to speak today. I have been at Cook County Cook County Health for 20 years and very proud to be part of our family here. I am currently the Associate Chair of the department, and actually, I have been the Director of Family Planning Services for almost the 20 years that I've been here, and soon it'll be time to find a new director, which is a wonderful thing. It means our family is expanding to meet the demands that we need to going forward. I can't say enough about family planning because it does determine pretty much everything about our lives, and certainly the women and the people that we've been serving in the Department of Obstetrics and Gynecology, but in family medicine and beyond. I have to say that a critical part of my family planning journey, it turned 18 recently, and he's doing college essays. And so I was sort of going back in time to one of my college essays, which I think I should have done better. And it was, what do I think is one of the most influential discoveries of at the time, the 20th century? We've now moved on from there. And I answered some question. I don't know what I even said, but I know what I would have said now, and it's birth control. There is nothing that differentiates us as human beings, as species on this earth, than the ability to manage our reproductive health. It changes everything. It is the most critical part of our self-determination. And we, as a community, as a society, have to make this happen for everybody who needs it and wants it. So I say to you today, I'm so happy to be part of the family planning team and at Cook County Health, but really we're part of a continuum, and the reproductive life journey starts early, and hopefully for most of us goes late. And it's not just the moment of time we need contraception, but it's every moment in between when we choose to have children or we choose not to have children. So I have to say I was on the labor floor last night, and I hope I looked pretty good for being up for many, many hours. We had a lot of safe deliveries. Commissioner Miller is here. There's a big initiative to have safe motherhood. So one of the most important things to safe motherhood is excellent family planning so that motherhood comes when it is planned and optimized. I can't say that we all haven't benefited from family planning in terms of our socioeconomic determination. So as we think about not just family planning being an important part of health, it is an important part of every facet of any of our given lives, whether we consider male, female, non-binary. So all of us benefit from family planning as a society, and especially the women that we serve. So there are a couple things I want to say in terms of the A's that we need to remember as we're in the ground, we're in the field, and we have to make these things happen. So when it comes from above, how do we get it done? So one of the A's, of course, is availability. It has to be available, as I am going to quote Shakira, whenever, wherever, I think is how she says it. It has to be available everywhere. So I'm going to speak to our leaders here that we need it everywhere. We luckily and fortunately have 17 sites across the county, including the jail and the JTDC, where we're able to provide family planning services. Has to be accessible for everyone, not just some people who have means, who don't. And again, that's part of our mission here at CCH. It has to be affordable. So again, many people can't stock them on shelves. I'm sure Kai and the team are working on that to make sure everyone has it available in their offices. We're very fortunate to have a pharmacy here that holds it for us, but that's not true for everyone, so that's really critical. Attitude. That's not usually one we think about when we're talking about the A's. We have to have the right mindset to think about family planning all the time, not when it's convenient or make it inconvenient, but all the time. And I'm going to say this, and I know I'm thankful that we're here today, it has to be apolitical. It has to be normalized. My grandfather was a politician, so I hope he's okay with what I just said. But I am grateful today because we wouldn't be here today if this wasn't a political matter and of the utmost emergency, if I may say. Alliances. We can't do it alone. We have been trying to partner for decades now, and it's finally happening. So that we are a community, the only way we can make it for everyone is if we work together to make it happen. The last one's not an A, it's an E, which is education. Because we can have everything in the world available, but if nobody knows how to use it, if people don't know how to access it, so on the patient side, on the provider side, we need the education. And that comes very young with sexual health. To, let's say, 101, 201, 301. It never ends. We still need education, education, education. And the last one's an I, innovation. We have a very important tool, which I'm excited about here, called Reproductive Life Imagined. We won an innovation award recently at the Quality Forum that we had. But we need to be innovative, all of us. We cannot do the same thing over and over again. We haven't moved the needle. So I'm, again, very excited to be part of this initiative so that we bring family planning to everyone in the way that works for everyone. So I'm very thankful for this opportunity. I look forward to this partnership and our family planning family expanding. Thank you.
So I believe that concludes our event today. Is there any questions? All right, wonderful. Well, then let us all line up in front and take our photo. Thank you, everyone, for joining us, and we're so excited that you were here to celebrate this momentous occasion of joining the ICAN network and increasing services to contraception. Thank you so much. Let's pose here for a photo. Thank you, everybody.
Testing 1, 2, 3. Like it?
From symptom to diagnosis. So yeah, I could talk about it all day, but just
Wonderful. Well, good afternoon and welcome. I'm really thrilled to see so much interest and enthusiasm for this critical conversation that we're having today. So thank you all for being here. I'm Katie Thiede, and it is my huge pleasure to serve as co-founder and executive director of Illinois Contraceptive Access Now, ICAN, a statewide initiative to advance contraceptive equity by de-siloing, destigmatizing, and normalizing birth control as basic health care. We do this in 3 key ways. 1, by partnering with safety net providers, including many of you in this room, to establish contraceptive care as a routine part of preventative and primary care. 2, by advancing and implementing policies that make it easier for people to access contraceptive care, such as the new HFS Family Planning Program, which you'll hear more about shortly. And 3, by engaging patients to make sure they have the information, tools, and resources necessary to make informed decisions about their sexual and reproductive health care and to demand the right to high-quality care. In the wake of the Dobbs decision, eliminating the right to abortion, millions of people are routinely being denied their right to make their own decisions about their own bodies and their own health. And while much of our collective focus has rightly been on protecting abortion access, we must also acknowledge that equitable access to person-centered contraceptive care is fundamental to reproductive autonomy. At ICAN, we hear from patients every single day who don't know where to go, who to trust, or if they can afford their contraceptive care. Even in Illinois, a state that leads the way in defending and advancing reproductive rights, people of color, people with low incomes, and young people face persistent barriers to accessing the birth control method of their choice. Today, you'll hear about the strategies adopted in Illinois and at the federal level to change this reality by driving systems change in how contraceptive care is delivered, accessed, and paid for at a time when the stakes couldn't be higher. I want to briefly highlight two of those now. The first is the HFS Family Planning Program. This new alternative Medicaid benefits program expands eligibility for coverage of family planning and related services for individuals making approximately $3,500 a month or less, and it is one of the most generous programs of its kind. We are grateful for the unwavering commitment of HFS leadership to ensuring that coverage under this program is comprehensive, equitable, timely, confidential, and flexible. This program builds on the state's already generous investment in family planning efforts made through the Illinois Department of Public Health's Illinois Family Planning Program. An estimated 1.2 million people are newly eligible for this coverage, and we'll be calling on all of you here today to help get the word out to patients and to support enrollment. The second is ICAN's Quality Hub Network. 12 of the leading safety net providers in Illinois are part of ICAN's Quality Hub Network: Erie Family Health Center, Howard Brown Health, Near North Health, Rush Adolescent Family Center, PCC Community Wellness, Heartland Alliance, Friend Health, Heartland Health Services, Promise Healthcare, SIU Family Medicine, Shawnee Health, and today I'm excited to announce that Cook County Health is our newest Quality Hub partner. That was a long list, but we would like it to be longer. By joining our network, these health centers have committed to providing same-day access to all birth control methods at low or no cost, and to delivering person-centered contraceptive counseling to all patients of reproductive age. We are proud to support their efforts with training, technical assistance, and peer learning opportunities. If you are here representing a safety net provider that is not yet part of our network, I invite you to join our movement to normalize birth control as basic health care. Finally, I'd like to express my deepest gratitude to the U.S. Department of Health and Human Services Office for Civil Rights, the U.S. Department of Health and Human Services Region 5 Office, and Cook County Health for their support in planning and hosting this event. Please join me in welcoming HHS Region 5 Director Michael Caponargi to say a few words.
I'm blessed with multiple microphones. Thank you, Katie, and thank you to everyone here. And good afternoon, everyone. It's great to be here with you all. Today, we're here to talk about access to contraception in an increasingly challenging environment. And at the outset, I want to say a thing or two about courage, the strength to do hard things in the face of daunting challenges. Everyone here today in the panel and in the audience has showcased tremendous courage in the wake of the Dobbs decision by not only continuing but ramping up your work to defend the rights of women to make their own health care decisions. Your work ensuring we bear witness and use the strongest tools in our professions to document the impact of Dobbs on public health directly informs our ability to do policymaking. So on behalf of Secretary Becerra, I'd like to thank our panelists and the reproductive health community at large for coming together to move mountains for our country's women and girls. At the outset, I'd also like to introduce my good friend and our speaker today, Director of Office of Civil Rights for HHS, Melanie Fontes-Rayner. Director Fontes-Rayner previously served as counselor to Secretary Becerra and is one of Secretary Becerra's longest-serving counselors. She served with Secretary Becerra when he was Attorney General in the state of California, where she led efforts to ensure equity in health care throughout the state of California. Director Fontes-Rayner.
Thank you. So I have slides, we can use them, but it's really a privilege to be here with all of you and to be here today. It's exciting, the work that ICAN is doing. It's, when you work in the federal government, you visit lots of places across the country. Sometimes the conversations are hard, right? I have a lot of conversations. I was in Indiana the day after I'm getting emotional because I guess, I don't know, I'm a woman, I don't know, I'm on some kind of drug. No, it's a joke, sorry, it was a laugh. Women are not emotional, that was a joke. But it's okay though, my therapist says. So, no, but I was in Indiana a day after their abortion ban went into effect. I was at the last abortion clinic in Indiana, which is a Planned Parenthood clinic. I was escorted with my staffer into the building because a man with a gun and a sign patrols the outside of the perimeter of their clinic. I met with doulas, I met with providers, I met with the front office staff, and people were sad, right? They're telling me stories about domestic violence and reproductive coercion. They're telling me stories about, sexual assault victims. They're telling me stories about just women who it wasn't the right time and they didn't want to be pregnant. In those kinds of instances, it's a somber conversation, but I also think they still feel a little bit of a zing from having the federal government come and listen and the work that we're doing, and not to be self-congratulatory, but I think that's important that they know there's still a government that is there standing with them and fighting with them. And it's just exciting to be here in a positive scenario, right? I mean, I understand not everything we'll talk about today will be, lollipops and butterflies. But I think it's really important that the state is taking action to increase access to contraception, and to do it in this way is so meaningful. And so thank you for the opportunity to be here with all of you. So we'll go ahead and go through the slides. I'll go quickly. So you all know this has been a significant priority for President Biden. We have 3 executive orders, one specifically focused on access to contraception, talking to all federal agencies across the government to build and bolster access to affordable, high-quality contraception. Obviously, the U.S. Department of Health and Human Services plays a significant role in that. The second executive order you see in the slide was one of the closer ones to when the Supreme Court overturned Roe last summer, and actually directed my office and HHS to go out into the community and talk with providers about federal law and compliance. I'd like to remind people, just because you live in a state that has banned a particular healthcare does not mean that you lack federal civil rights laws and that you lack privacy rights. And then, of course, President Biden issued a memo on ensuring access to safe medication abortion on the anniversary of what would have been the 50th anniversary of Dobbs. Next slide. So the access to comprehensive reproductive health care, including contraception. So we know that these executive orders lay out the president's mission to expand access to contraceptives. That includes emergency contraceptives. That includes high-quality family planning services. And that also includes the need to make sure that whoever you are, wherever you are in your life, that you have access to contraceptives through that coverage. Next slide. Keep clicking. There's 6 bullets. So, yeah, I think you got them, 2, 4, 6. I might have counted wrong. But so in this space, the U.S. Department of Health and Human Services has been really prioritizing this area. So we're thinking about over-the-counter contraceptives. The administration just did a request for information through the Treasury, Labor, and U.S. Department of Health and Human Services for health insurers and carriers in the private insurance market to make sure we're thinking about, are these covered through the ACA benefit and beyond when these drugs go over the counter, making sure that people have access to them, understanding that that's the next sort of venue we're going towards. Thinking about contraception and Medicare. We don't think about that, but Medicare covers persons with disabilities who might still need access to contraceptives. And what can Medicare do to improve access to that for those beneficiaries? Thinking about within the Medicaid program, right? We know HHS, the Centers for Medicare and Medicaid Services, has put a lot of different options out there to help with maternal health care, to help with family planning choice, and thinking through those and making sure those services are covered through the Medicaid program. The Veterans Department has put out a rule to bolster access to contraception and protect access abortion for veterans and federal employees. And thinking about our college students and sort of the data side of things. Next slide. Keep clicking. So HHS there's so many task force now. That's not a bad thing. I think it means that we're in the moment right now where we all have to fight for reproductive justice, reproductive health care, and that includes birth control. So there is a White House task force on reproductive access that was created by President Biden. Secretary Becerra is the co-chair of that with Gender Policy Council Chair Jed Klein. I sit on that as the U.S. government with other cabinet officials. There is an HHS task force. This HHS task force has really focused HHS's efforts thinking about abortion services, access to birth control, patient privacy, accurate information, which we know can be a real big barrier to many people across the country, access to information, non-discrimination healthcare, and then supporting the work of the FDA. The U.S. Department of Justice also has a task force in this space, so I think it's good, right? That means there's a lot of agencies thinking and working in this space. I also just think to lay people who, task force is a task force, right? So you're not going to distinguish between them, but it's good because I think it's on all cylinders. We're doing all the things that we can. Next slide. So my office is the National Civil Rights Office in Healthcare. And that means that we have 11 offices across the country in 11 different cities. We have an office here in Chicago. We have an office in Kansas City in this region. And we do non-discrimination health care, which can both be in this space, birth control, family planning care, as well as general reproductive health care. So earlier, last year, we issued guidance to pharmacies, for example, reminding them, hey, just because the Supreme Court decision said X, and that's all over the news and perhaps creating a lot of fear and stigma around the country in terms of what happens in a pharmacy, that doesn't mean that you're no longer obligated to follow federal civil rights laws. And so we put out guidance reminding chain pharmacies, hey, you still have to follow federal civil rights laws, and that's inclusive of sex-based discrimination, which can include pregnancy, and that's also inclusive of disability discrimination. Because we were getting a lot of complaints where we saw a 65-year-old woman going to her pharmacist to fill a script for methotrexate, which she uses for rheumatoid arthritis, and she has used that for decades. Suddenly being delayed in being able to access this prescription she's been on for years because of the Dobbs decision. We saw cases where women were going in with miscarriage management. They had already miscarried, and they were seeking misoprostol, which is often prescribed in this situation, to manage that, again, being delayed in being able to access those drugs. So again, we tried to remind pharmacists, hey, you still have duties here. I understand it's confusing, and you're on the front line of this in many ways, but we have to still remember we're following the law. Through that, we were able to come to an agreement with Walgreens and CVS. Now they have specialized teams to talk about their processes and complaints. They're tracking their complaints. They now have established training for pharmacists across the country. There's a set hotline or phone number to call if you have one of these delays or denials. And again, I think we've moved much in the right direction beyond that. But right after Dobbs, I think there was a lot of interest in what was happening in pharmacies. And so we were really proud of this work to be able to work in this space. We also have a proposed rule, which we're working on, that would get into this as well in the insurance space and with providers that we'll continue to work on through Section 1557 of the Affordable Care Act. And, we've seen cases, right, post-Dobbs where some, state actor has taken it upon themselves to suddenly decide birth control, including emergency contraceptives, is not birth control, and that it's abortion, and then taking it upon themselves to deny people that. And so I think we're trying to really educate folks, let them understand just because you live in one of these states doesn't mean you don't have rights, and to work with a lot of local partnerships to make sure we're educating people about their rights and what the state of the law is. Next slide. Again, these are some of the steps HHS has taken on birth control. Last year, Secretary Becerra met with all of the major CEOs of all the insurance companies alongside Secretary Walsh to say, hey, you have to do better. It can't be the case that women aren't getting their contraceptives that is promised by the Affordable Care Act. That turned into a guidance and possible enforcement action. And the departments have issued a proposed rule to allow for more access to contraceptives, given the state of some exemptions that might exist in the birth control space of the previous administration. The FDA has taken steps to make the first over-the-counter non-prescription use to prevent pregnancy prescription oral contraceptive. And again, we now are working in the space of the over-the-counter space. That says over-the-counter space. That sounds weird, right? I don't know. Anyways, you understand what I'm saying. Next slide. We like to talk about in my office and remind folks under HIPAA what is and isn't required. I think a lot of people think, so two things. One, I think a lot of people think it's my medical information, it's protected. That's not always the case. I can't always help you if perhaps you have an application on your phone or perhaps you upload your data to another website that's not covered by HIPAA. So we really try to remind folks to be vigilant of their own privacy in this moment, because we are really at a nexus where private medical information can and is being misused to track providers, to track patients, and I think to really violate the trust between the patient and the provider. And we like to remind folks the current state of the law. Under the HIPAA privacy rule, HIPAA does not require disclosures. The only two disclosures, and that means that you have to give someone's data over. Those disclosures that are required under the law are, one, when a patient shows up and says, I'd like my medical records, that's required. And two, when there's a large cyber breach, they're required to disclose that to us so that we can then investigate it and keep the public apprised of that breach. Otherwise, HIPAA has permissible disclosures, meaning they're permissible, but they're not required. And so we like to educate folks on this. We have a guidance up with examples, but we like to educate folks because I think as we think about a post-Dobbs reality, I'm less concerned about the reproductive health clinic. I think they understand very well what they have to and do not have to do, but remembering that it's the full spectrum of someone's care, whether they're getting a blood test at a hospital or they might be getting a pelvic exam, that those are the kinds of records that we're seeing the people going on fishing expeditions to try to target providers and target care. Next slide. So we actually propose a rule that would prohibit the use and disclosure of that data by a criminal, civil, or administrative investigation into proceeding against any person into connection with seeking, obtaining, providing, or facilitating reproductive health care where such care is lawful. And that sounds broad, it's intentionally broad, because we know a lot of these laws are not just targeting providers anymore or individuals, they're targeting anyone tangential to the care. And so we have this proposed rule, the comment period closed, we're working on trying to move it forward, but I think it will be a really important tool so that it can protect that information if a person travels from a state where the care is banned to a state where the care is lawful, and then goes home, so that person and their records are protected, and that provider where that patient went in the lawful state is also protected, because we are seeing states reach in to try to go after providers. Next slide. We talked about this a little bit earlier. The FDA updated the label changes to make very clear that Plan B one step. The scientists carefully reviewed the available data and evidence and determined the current science supports the conclusion that Plan B one step works by inhibiting or delaying ovulation and the mid-cycle hormonal changes. The evidence supports the conclusion and there's no direct effect on fertilization or implantation. Obviously, this is a really important step by the FDA to make very clear that emergency contraceptives are contraceptives. And so again, we think an important step where the FDA is being guided by the science and following that. Next slide. And then this is just our last slide. I just remind folks, you can follow our office. You can file a complaint. The bottom is how you can email or call us. The complaint portal is in the middle. If you or you feel someone you know has been discriminated against or they have their privacy rights violated, you can file a complaint with our office. You can do it on behalf of somebody else. Organizations oftentimes will file them on behalf of an individual, or if they see something systematically happening at a particular hospital or a city or a county. But again, we like to remind folks, because we're a pretty small office, and we really are reliant upon our community contacts to make sure that folks understand A, what their rights are, and B, what to do if they think they've been violated. So it was really an opportunity to be here with you today, and I look forward to taking questions and talking with you more. Thank you.
Thank you very much, Director Fontes-Rainer. So we've got a fantastic panel here, and I'm going to ask each panelist when I ask them a question if they could just introduce themselves and give their title and where they come from so we can know their lived experience and their background. I'm actually going to start with you, Director Fontes-Rainer, with a question. Could you talk a little bit more about the work that OCR is doing about protecting the privacy of patients accessing reproductive health care? I know it was one topic that was mentioned, but if you could drill down on it a little bit more.
Yeah, and I appreciate that. And I'm going to take my jacket off because I'm on a medication right now for my endometriosis that actually is falsely putting me into menopause. So I'm having a hot flash while I'm talking to you. Isn't that awesome?
Yes, it's real life.
It is. And it's good we're talking about it. So, yes, our office has taken a lot of steps to try to protect privacy. So I would say, one, understanding the limits of the law that I have to protect you, and so being really vigilant. What kinds of settings do I have open on my phone? If there's a free application, should I download it in the first instance or reconsider that? Do they use things like end-to-end encryption to protect my privacy? Thinking about not storing protected health information on my phone, my tablets, or devices. Making sure that I'm being cognizant of where I'm storing my protected health information in the first instance. I say all that because after Dobbs happened, there was a lot of focus on period trackers, and I think largely people have taken steps to try to fix that. But we know it's not just period trackers, right? Your data is being sold when you go to Target to data brokers, and some of that I have no control over it, most of it. The FTC, they regulate and control some of that, but some of those instances, they don't either. And so it's really being cognizant, especially right now, about how you can maintain and control and be diligent about your own privacy, because no one's going to have your privacy interests more protective than yourself. And then, again, reminding providers that the current state of the law, we have no changes, is HIPAA does not require disclosures. So if somebody is coming into a clinic or a facility and seeking broad swaths of medical information, and when we've seen this across the country, being very diligent about where that's falling into one of the HIPAA permissible disclosures and really thinking about it with your organization about whether or not you'd release that data. We really are seeing instances, and perhaps you all have seen them here in Illinois, where folks are reaching into places where care is lawful to go after them in other communities and other places. And so more to come from us on that as we work to finalize our rule, but I think a really important topic where I honestly think a lot of people just don't have enough information about what the state of the law is and what their rights are. And so that's one way we can all work together to try to better educate folks.
Thanks. You just mentioned rulemaking and just pivoting over to action. What are some of the actions that HHS has taken to expand access to contraception?
Yeah, so I have a huge list right here. The executive, so we know that the Title X Family Planning Clinic, they have put out additional grants. They've also put out their rule, which they've worked on, including new guidance, technical assistance, and training resources to help providers understand their obligations under federal law. We talked a bit about the Centers for Medicare and Medicaid Services, particularly through the ACA coverage, and making sure that that coverage is a reality for folks, making sure that women don't have to. I remember once being I was actually in the listening session with Secretary Walsh and Secretary Becerra, and an insurance company said, well, you have to, I can't remember the actual terminology, it's not prior authorization, but it's a failed step therapy. And I said, but if a contraceptive fails, you're pregnant, right? Like that can't be the unilateral or uniform approach to this. And so they have put out clarifications around some of these things to help with the insurance industry. And it's also just making sure in that space that as we think about over-the-counter, that we can continue to cover that. We talked a little bit about employees and college students, particularly the President Biden's call to action across federal agencies. I think you asked specifically about HHS. And we know specifically HHS announced a new public-private partnership, the expanded access to contraception with Upstream, a national nonprofit that provides health centers with free patient-centered evidence-based training and technical assistance to eliminate provider-level barriers. But I think overall around the country, we're seeing, existing federal clinics, especially those that provide reproductive health care are at capacity, have waiting periods because they're getting spillover from communities where they don't have that care. And I know that's something very real as a department. We're thinking about what else we can do. And I know within Medicaid, we spent a lot of time really thinking about how do we expand and bolster family planning? How do we expand and think about postpartum coverage options and other things to improve maternal health, given the significant disparities that already existed before Dobbs and now are like completely on fire because, you know, it's a reality now where women are being told, go wait in your car, you bleed out more, which does not, you know, make for healthy birth outcomes, healthy pregnancies, or healthy people. And so it's something that I know we continue to work on.
Thank you. Lizzie Whitehorn. Lizzie is the incoming director of the Illinois Department of Health and Family Services. Lizzie, we know that one of the biggest barriers to contraception access is prohibitive costs. Can you tell us about Illinois' new HFS family planning program to expand coverage for family planning services and make it more both affordable and accessible?
Sure. Thanks, Mike. Thanks for having me. And thanks to ICAN for putting on this event, and to my fellow panelists who are here too. It's great to see so many partners here who are on the ground providing reproductive health care and supporting reproductive health care in Illinois. I want to make sure everyone knows what Mike said, which is that I have not officially started in my new role, but I did serve for almost 5 years in Governor Pritzker's administration as the first Assistant Deputy Governor for Health and Human Services, so worked closely with HFS. It also means you can't ask me any hard questions yet. So, I said yes to speaking here because this topic is so important to Governor Pritzker and to me as the next director of HFS. I'm proud to be part of an administration that is fiercely protecting women's rights and the rights of all people to access affordable, comprehensive, and quality reproductive health care. HFS and the Governor's Office were proud to partner with ICAN as well as the Illinois Public Health Care Association and the Chicago Department of Public Health to launch the Medicaid Family Planning Program in November of 2022. This program is a critical way in which we as a state are expanding access to a full range of reproductive health care while bringing in federal Medicaid dollars. The program covers family planning and related reproductive health services for eligible Illinois residents, regardless of age or gender, who otherwise do not qualify for Medicaid because their income is above the normal threshold for full Medicaid coverage. This includes contraception, HIV prevention, STD and STI testing, cancer screenings, permanent birth control, such as vasectomy and tubal ligation, family planning counseling, and much more. Close to 9,000 Illinois residents have been enrolled in the family planning program in its first year. We expect this number to grow, as we know it can take up to 3 years for enrollment in a new benefit program to reach its full potential. The state is also working through the redetermination process with the end of the public health emergency, and we expect that will also impact enrollment in the family planning program over the next year. There's more work to be done. HFS continues to work with our sister agency, the Department of Public Health, to ensure coordination with Title X programs in order to maximize access to family planning services throughout the state. And we look forward to expanding current efforts to build a coordinated, robust outreach program to enroll as many people as possible who are eligible and in need of health care coverage into the family planning program. We're also continuing to work with DPH and the Department of Financial and Professional Regulation to implement the state law that now allows pharmacists to dispense contraception based on a standing order from DPH. A lot of work with CVS and Walgreens, of course. As I said at the start, protecting and expanding access to quality reproductive health care is a major priority for the Pritzker administration, so I would be remiss if I didn't take this opportunity to mention a few more initiatives that HFS is working on to support these efforts. In the wake of Dobbs, we've been working to support providers who have seen an enormous influx of patients coming to Illinois from other states to access abortion and other reproductive health services that they can no longer access in their home states. This creates a number of logistical and financial pressures on our providers, of which everyone in this room is well aware. After conversations with providers about what is needed to handle this influx while ensuring quality care continues, we launched the Complex Abortion Regional Line for Access, or CARLA, earlier this year in partnership with Rush, the University of Illinois Hospital, and the Chicago Abortion Fund. Carla will provide a resource that is one part of the puzzle, but a critical one, so that pregnant individuals with complex medical needs who face barriers to accessing abortion care can receive the right level of care in as efficient a manner as possible. Carla is a new hotline staffed by experienced nurse navigators to provide complex medical intake and coordination, streamlined access to financial support for clinical care, support for transportation, lodging, and childcare. Importantly, these services will be provided while keeping the individual's information within a privacy system, so that, for example, out-of-state providers can't see that a patient received care through Carla. Finally, I want to highlight the work we have done to improve maternal and child health, particularly as related to postpartum care. We know that the postpartum period is critical to the health care of the mother, especially for Black women and for those who receive health care coverage through Medicaid. Those on Medicaid at the time of delivery are at higher risk for postpartum depression. For those with opioid use disorder who recently gave birth, the risk of overdose is highest 7 to 12 months postpartum. There are so many statistics, both national and local, that I could talk about, but I thought I'd highlight just a few from the Maternal Morbidity and Mortality Report that DPH recently released. In Illinois, from 2018 to 2020, an average of 88 women died while pregnant or within 1 year of pregnancy. In that same time frame, over 50% of pregnancy-related deaths occurred more than 60 days postpartum. And pregnancy-related mortality remains the highest for Black women in Illinois. Recognizing these postpartum risks, Illinois became the first state in 2021 to receive federal approval to extend full Medicaid benefits with continuous eligibility through 12 months postpartum, regardless of how the pregnancy ends. Also in 2021, Illinois became the first state to receive federal match for this extension, regardless of immigration status. Additionally, the Medicaid program now covers a second preventive postpartum visit in alignment with an ACOG recommendation, as well as a previous recommendation from the Illinois Maternal Morbidity and Mortality Report, so that women know they will receive coverage for a visit at 0 to 3 weeks and 4 to 12 weeks. These visits are a clear opportunity for prevention, but also an opportunity to optimize postpartum health, including to address desired contraception. HFS is also working to add doulas, evidence-based home visiting programs, and certified professional midwives as new provider types and covered services. These are just some of the initiatives that HFS and the Governor's administration are working on to advance contraceptive equity, as well as protect and expand access to affordable, quality reproductive health care more broadly. I'm excited to continue this work at HFS, to partner with our sister state agencies, as well as health systems, providers, customers, and advocates like those gathered here today. As a mother of a daughter and a son, I know that this work is so critical to ensuring the health more broadly of all residents in our state. Thank you.
Thank you, Leslie. And even though it's premature, congratulations in advance on your new role. We're excited to continue to work with you. Dr. Kai Tao. Kai is one of the co-founders of ICAN, and thank you again for you and your team for organizing today's discussion. You served on a variety of state and federal quality committees around reproductive health. With this experience, can you tell us how Illinois is doing in the provision of contraceptive care?
Sure. Good afternoon, everyone. Thanks for coming. It's all right. I'll just lean down like this. So, you know, when we think about quality, I think when you think about Illinois, there's been a lot of great policies. We're lucky federally. I'm glad we have your leadership there. We know at the state level, everyone can think about like, oh, I'm glad I'm in Illinois, right? But what it really comes down to is great policies on the book often don't translate to impact on the ground, right? Because there's no one doing that work. We get excited. We get a policy. It passes. There's a lot of headlines. And then what happens, right? A select few may know about it, if they know about it. And so I think that's where the work really needs to happen. When we look at some of our data, which are sparse, which is also a reflection of the priority that's been done on contraception, right? When we look at community health centers, about 1 in 5 are actually getting receipt of contraceptive care and delivery. 1 in 5 people reproductive age. I think it was actually women of reproductive age, but I want us to be sure we're as inclusive as possible. And that is from receipt of utilization. So looking at Medicaid records, what have you, right? 1 in 5. That seems like a lot more people could be getting routine screening for contraceptive needs and desires. We've said it many times, there's stickers everywhere. We believe birth control is basic health care. What that means is that every time you go see your primary preventative care doctor, nurse practitioner, they should be routinely asking any person of reproductive age, we say kind of the 12 to 51, about their contraceptive needs and desires. We're not prescriptive because we know that doesn't work in a health center setting that is very complex and already has many other needs. But we want to be sure that that care that they ask, when they ask about contraceptive needs and desires, is trauma-informed, respectful, unconscious bias checked, evidence-based are informed, and lastly, reproductive well-being centered. Those acronyms stands for truer care. So often we talk about, we want to make sure, however you do it, that you're providing truer care in the primary care setting. So trauma-informed, respectful, unconscious bias checked, evidence-based, and reproductive well-being centered. And that last term I think is a little bit newer to, I sit on several federal groups, so we talk about like what's out, what's in, right? So reproductive well-being centered is sort of thinking about the person across their entire lifespan. It's not just, oh, you're pregnant, get into prenatal care because we're measuring you. First trimester, how soon can you get in? It's everything from often with a person in the uterus, from menarche to menopause, right? And caring for that person and creating the circumstances and creating the infrastructure so that person can decide if, when, and under what circumstance be pregnant parent. And so I'm kind of answering your question slowly. I just want to touch on 2 things I think will be really pivotal and directing to kind of what you said about CMS, right? We know under CMS, Center for Medicaid and Medicare, they talk about different quality matters, right? A lot of you guys can think about, especially if you're from the health center, what are things that are measured and that gives you a sense of how you're doing, right? If I was asked I see a lot of my providers out there, how's your team doing on screening for diabetes? Most of them can pull out some data and say, we're doing pretty good. This age, this is how we're doing this. When I talk to payers and providers and a large group, and I ask, how are you doing on providing contraceptive care to your patients? The answer is often, I don't know. I think we're doing okay. I know this many, get into prenatal care. This many get screened for chlamydia. Why? Because those are measurements. So I'm going back to why it's really important, and I hope we can take up that leadership here at the state level, at the federal level, to make sure CMS has now adult and child core quality sets that they recommend that often correspond, I'm throwing out a lot of acronyms, HEDIS measures, right, where we use insurance, UDS measures under community health centers. As of fall 2024, it'll be required for anyone 15 to 20 years old to be reporting what kind of birth control methods are being used. It's called method mix sometimes, or sometimes you think about as most and moderately effective. And it's not because those are the methods that are most important or that we're trying to aim for any specific number of people using shots or people on the implant. That's not what we're saying. But I think it's important we try to understand how is this playing out in the state of Illinois. I mean, hopefully nationally too, and that's why it's become a national mandatory measurement for 15 to 20-year-old and voluntary for the adults 21 to 44. So I want to make sure that we can be capturing that data and so we can truly understand where we need more work. And then the last piece that balances that is about patient experience. There is a 4-question survey that talks about how was your care for contraception. And that is critical to collect because for too long we keep saying, well, we think they're doing okay. We need to start measuring this. And we often hear there is problems. And so if we know that we can use a survey that's NQF endorsed and start collecting that feedback, and myself as a provider, I can know, do my patient feel respected? I can know if my patient said she knew all her methods before she made her decision and that she felt like she got her birth control of choice. So, thank you.
Thank you. So we have Lizzie coming in, and then we have the CEO of Cook County Health, Israel Roca, who's been here for many years. Israel, you've been leading Cook County Health during a really challenging time. Can you tell us a little bit about how improving access to high-quality contraceptive care for the patients of Cook County Health align with your and Cook County Health's larger goal to advance health equity?
Sure, absolutely. First, I want to say welcome to Cook County Health. We're so excited to have you here, and we're very honored to be hosting you. And I do want to say that we're very fortunate that both our Cook County Health president, as well as our board of directors and the commissioners, are very supportive of expanding these services. And I know here with us are two of our commissioners who would like to introduce them briefly. I see our vice chair of the health committee for both the board and the Cook County commissioners, Commissioner Dennis Deere, who's with us here. And then also we have a very strong advocate and Commissioner Donna Miller for Women's Services, and who's our Commissioner for Women's Services. If we're serious about achieving health equity and ensuring that everybody has the right access to their care, it's making sure that everybody has the right care at the right time in the right place, and that it's fully accessible for whatever's available anywhere in the world. We want to make sure that it's available. That's what equity means, that there is not a substandard of care, there's not less care, there's not what's provided, it's what you're entitled to. If it's available, that you have access to it, and that's what we're working for every day. And to do that, Cook County Health has been working across all of our locations. So we have, of course, our location here at Strozier and Provident, but we also have 17 clinics throughout the community. We have our Public Health Department for Education. We have a CIRMAC division, which provides all correctional health services for the City of Chicago and for Cook County. And then we have, of course, our Core Center, which provides all special infectious disease care programs, including the largest HIV center in the Midwest. And so we have quite an expansive services that we can provide. And then County Care, our plan, which has almost about 450,000 members. What we have really been working on to do in terms of women's services to make sure that we're providing contraceptive services where people need them, and that we're providing any type of reproductive health services and procedures that people will need, including long-lasting contraception access, as well as access to abortions, other family planning services, and that they remain uninterrupted and fully available to individuals. We are very thankful for our participation in the Title X program. We have been working to increase our family planning program and services across all of our locations. Right now, our most robust locations are Strozier and North Riverside, but we are quickly adding new services starting in January 2024 that will be restarting our services at CIRMAC, which is our providing all services and access to providing for women who are patients of ours through our Correctional Health Services Division at CIRMAC, as well as we are going to be having even expanded programs at Belmont Cragen, which is a refugee intake center, and all of our clinics throughout our locations, including adding additional services that we have to the rest of our care services, so that we have from point to point, no matter where you are in Cook County, all you have to know is come to Cook County Health Clinic, and we're going to ensure that you have a full range of access. And if we can't give it to you at that location, we're going to make sure that we provide all transportation assistance so that you get to the location, and ensuring that guarantee of care. What is really unique for us is also that our Title X family planning services are able to be provided to all patients, that we make sure that whether you're uninsured, underinsured, whether you have insurance, no matter what it is that you need, if you are standing before us, you have an availability to get this service. And I think that's the most important thing, is that there is nothing that would prohibit you from not being able to get the services timely. And now, being part of the ICAN network, we've refortified your pledge that you would have it within 24 hours. And so we can make sure that all you have to do is get to us. Part of that service is also that we have really developed some programs like our maternal child health coordination program that has been working with County Care, that affirms members access to postpartum services, reproductive services, contraception services, and that creates a family planning program. And with that, I do want to recognize who's with us here in the audience is both our current team, who ensures that continuous network access and monitors to make sure it's available. We have Dr. Alicia Patel, Callie Matoyer, and our Service Line Business Director, Christina Arbina, who are with us as well. So thank you for that. And then ensuring that family care is not only in our own clinics, but through County Care. If you are seeing other providers, we have with us Dr. Yvonne Collins, Anaya Stoller, Maeve Dixon, and Emily Lupo, who are our champions at our County Care plan to ensure that consistency of access. And what they have done is to make sure that in 2023, County Care covered over 16,000 contraceptive prescriptions, including 3,000 long-lasting reversible contraceptive programs, and then that represented a 2.4 increase since 2022. They also operate a Brighter Beginning County Care program that ensures that comprehensive network. The Brighter Beginnings website and Brighter Beginnings text message campaign also highlights access to reproductive health services and additional benefits, including free pregnancy tests monthly that are available. We also are very excited that the Cook County Health Family Planning Team has created a new program for reproductive services to re-envision and called REPLY, which is now an innovative patient-centered reproductive health platform that empowers individuals to be the primary drivers along the reproductive health journey. REPLY platform provides goal planning with the very first data visualization tool for reproductive life goal setting, tracking, educational resources, a community for open dialogue, and provider interfacing, making it easier for providers to connect regarding the individual health goal needs of a patient and their families. REPLY provides a set of quality metrics for the clinical enterprise, enabling us to assess whether we're effectively addressing a patient's needs. The data empowers administrators to gauge the achievement of patients' progress, the need for healthcare goals, to make sure that we're structuring and creating access at each of our care points, and ensuring that factors like pregnancy intentions, referrals, and contraceptive choices are being met. As we heard from one of our speakers, we can create policy, but if we do not have the data metrics, analytics, and learning collaboratives in place, they remain just a policy. So what we're most proud of here at Cook County Health and how we're able to achieve equity is that we're ensuring that the policies that are being created and supported, especially from this administration, are being translated to ensure that that healthcare access is being accessible, attainable, and achievable from the patients. And here at Cook County Health, from end to end of the county, we make that commitment to be available. And the only thing anyone has to remember is simply walk through our doors, call our phone number, and we will make sure that you get the help and the health that you need and are entitled to.
Thank you. Thank you. Thank you. Kim Knox, you're a healthcare provider at Friend Health. As a clinician serving patients at a community health center, why do you think birth control should be a routine component of preventive and primary care, and what does this look like in your practice?
So hello everyone, good afternoon, and thanks to ICAN for having us here to represent Friend Health. And at Friend Health, we make a commitment to our patients to provide quality health care for patients across the entire lifespan. And I work in OB-GYN. I've worked in OB-GYN for over 30 years, and I've dealt a lot with family health and reproductive health as well. And our patients, along with partnering with ICAN over the last 2 years, we have even made it more of a priority to provide a quality healthcare education, and as well as to dispel a lot of myths surrounding birth control. ICAN, and it may look very simple, but is very beneficial to our patients. They come in, they have a lot of signage on the wall. The patients walk in and they're looking, they're reading. It's accessible. We're at a healthcare center on the south side of Chicago, so the reading levels may not always be 8th grade or above, and the signage is very beneficial to our patients. They can read it, it's easy for them to see. They come in and we go in and we ask at every visit with the patients, we talk about family planning. And with the ICAN, along with partnering with ICAN, they want to see what's in the box. They want to talk about birth control. We actually have models, so we're actually on the ground. We're showing the patients, here, this is what the IUD looks like. This is what Nexplanon looks like. So we're not just talking about it, we're also showing them. They can touch it, they can feel it. We can explain it. We take the time, we go the extra mile, and it's very beneficial to the patients. They really appreciate it. They really consume the information. And then there are also a lot of barriers to care, I feel like, with insurance. And that's what we're all saying here, as well as with myths on social media. Birth control can kill you, or it's bad for you, it's going to give you cancer. And we spend a lot of time dispelling those myths. And I feel like with partnering with ICAN, it's been so beneficial. And our patients even tell us we have the survey, and they all fill out the survey, and they love the extra mile going with the partnering with ICAN, and also with us just taking the extra time to explain it to them. Another barrier of care could be the lack of education. So I feel like with just taking a few more minutes and being able to educate our patients has made such a significant difference. I have patients, we also take care of patients on telehealth or virtual visits as well, and we provide access to family planning at those visits as well. And they have access to emergency contraception. And we also talk about, with emergency contraception, a plan B, but we talk about a plan A. Let's talk about contraception. Let's talk about what's available to you and what your needs are. And I think in partnering with ICAN, it's been very helpful to our patients.
Thank you very much. Thank you. And again, you just hit on something we all talked about, which is we're all making data-driven policies, but it leads to a better health care outcome. And you know, your work directly with patients is evidence of that. Dr. Hanyu, Stephanie Leo, you're another provider. As a pediatrician at a community health center, what are some of the unique barriers that adolescent patients face when accessing birth control?
Absolutely. Thank you so much for having me. So I'm Dr. Stephanie Leo. I'm a pediatrician and the director of pediatrics at Alivio Medical Center, which is a 7-site federally qualified health center serving the southwest side of Chicago. And some of you are probably wondering, why is there a pediatrician here talking about birth control? If you're a parent, I hate to break it to you, sometimes teens have sex. And sometimes they haven't yet, but they're kind of thinking about it, and they have some questions, and they've seen some stuff on TikTok, and they're not really sure if it's true. And so most often, I am the person that they talk to about this. So I actually want to share with you guys a little spiel that I give to all of my patients when they come in for a checkup. And there's a 2-part spiel. Sometimes this happens in Spanish, sometimes it happens in Mandarin. I'm going to do it in English for you all. But the first part of the spiel goes like this. After I've politely asked their mom or parent to step out of the room, I say, okay, now that your mom is out of the room, I'm going to ask you some questions. I need you to know that everything we're about to talk about is 100% confidential, which means that I'm not going to tell your mom or anyone else unless you ask me to. The only thing I can't keep secret is if somebody's life is in danger. But that makes sense, right? They nod, and then I say, and I promise you, I'm not asking this to be annoying. I'm asking because I care about your health. I want to help you. There's no judgment here, so please be honest. You can probably tell I've said that a million times because I've literally said that a million times, and I say that to everybody. And I say that before I ask them about their gender identity, their sexual orientation, and whether they've ever had sex with anyone before. And that's because I think this is so, so important. I talk to our teens every day, you know, at my regular clinic. I also work at Benito Juarez High School, where I'm part of a school-based health center. And across all of these settings, you know, I'm working with patients who are first and second generation immigrants from Mexico, from China. Lately, they're refugees from Venezuela and across Latin America. What unites all of them is none of their parents talk to them about sex. Every time we ask, they say, well, either we've never talked about it, or maybe one time they stared at me and they said, well, don't get pregnant. Or obviously when you're 32 and married and giving me my first grandchild, that's when you will have sex, right? But that's not how things work. And, you know, thinking about what are the challenges that teens face, let me just walk you through some of the challenges that my patients face. They have after-school jobs. They take care of siblings. They have really popular TikTok accounts that are really making it big. They have dogs to walk. They're trying to figure out how to sleep somewhere that's not the floor of a police station. They're trying to get to school without being shot. They lost family members during COVID. They're depressed. They have a lot of things happening. They deal with racism, sexism, poverty, all of the different things that are happening in our communities, not just on the south side of Chicago, but across the country. They're figuring out who they are. They're thinking about coming out, and they're worried about what their abuelita's gonna say, or that, you know, this is gonna cause a fight and their dad's gonna beat up their mom again, or their dad just quit drinking and this is gonna push him back to drinking. these are not things that I've made up. These are real things that happen, right? And on top of all of this, they're trying to figure out what's real, what do they have access to, how do you pay for it, how do you go to the doctor? What do you mean there's multiple Walgreens and I have to know which one I go to? Like, can't you just send it to Walgreens? These are huge barriers, right? And so things like the HFS Family Planning Program, the Title X program, these are ways to at least start to bridge that gap. It means that in Illinois, if you come and see me or Kimberly or one of our providers, you can be promised that whatever you need can be confidential, it can be paid for, and that someone is going to take that moment to try to figure out for you, is it telehealth, is it transportation, what do you need to keep this private? And before you feel like I'm some kind of horrible person who's always trying to make teens hide things from their parents, I promise you I'm really not. I ask all of them, I say you should talk about it with, a trusted adult. I have teens who come with their moms and, they joke about their depot shots and, we chat. But I also have teens who tell me they're terrified, that their dad is counting the number of tampons in the bathroom every month to make sure that they're not pregnant. And they've got a gun over the door in case a boy is trying to sneak in the window. That is not always a safe, supportive environment to have these conversations. And also, teens are really smart and they're very resourceful. And I think that's why programs like this, when we talk about having policies and programs, it truly makes a difference because the people who are gonna navigate this very often are teens. Recently, I had a teen who marched her ex-boyfriend on a 45-minute walk to come in because you bet he was gonna get tested and treated for the chlamydia that somehow she knew he had. I had a teen get their Nexplanon placed during lunchtime because she has a perfect attendance record and a 4.0 GPA, and nothing is gonna mess that up. Not being pregnant, but also not getting the Nexplanon either. Like, she's gonna make that perfect attendance record. And recently I had this really amazing experience where a teen came back maybe 2 weeks after a checkup, and I was kind of confused. There was no reason given for why he was scheduled. He was just scheduled. He came by himself, and I said, so what brings you in today? And I thought maybe he had a cough or something, and he kind of looked at me like I was dumb. And he said, well, you told me I was supposed to come in and get tested for STDs, and you said I could come by myself. And I said, oh, you mean when I said that spiel that I say 1,000,000 times a day, you were actually listening? And sure enough, he had brought himself in, we did the thing. And this is where I got to tell him the second part of my spiel, and this is why I'm so excited to be here with you guys today, because the second part of my spiel goes like this. Thank you so much for being here and talking to me about your health. Because you live in Illinois, you have rights. Because you're part of a special program that pays for your reproductive health care, everything we do today is free and confidential. Please make sure you tell your friends too. So thank you so much to ICAN, to Alivio, to Doctors for America. We are leaders in Illinois. I could not be more proud to be a physician in Illinois. And honestly, I don't think I could work anywhere else because I would hate to not be able to offer that promise to all of my patients. So thank you.
Thank you very much, Dr. Leo. It's important to hear the perspective of a patient. Michelle Johnson, can you please share your experience as a patient accessing contraception care, and what do you think birth control needs to be a routine component of basic health care?
Absolutely. Thank you all so much for having me. As he mentioned, my name is Michelle Johnson. I am a community advisory board member with ICAN. So thank you all for having me. And like Director Fontes Rayner mentioned earlier, I also have endometriosis. I have been an endometriosis patient for about 15 years now. And if you're not familiar with that disease, I'll give you a really scaled down version, but endometriosis is a condition where abnormal tissue that is similar to that which is found in the uterus. That's a very important distinction. It's similar to what is found inside the uterus is found outside of the uterus. It can be found and has been found in any area, any organ throughout the body. And so while it is not a wholly reproductive centered disease, the majority of patients who are diagnosed, that tends to be where most of the problems are. For about 40% of people diagnosed with endometriosis, it does take our fertility. About 40% of endometriosis patients are rendered infertile. including myself. And the reason why I give this backstory in the context of talking about birth control is while there's no definitive cure for endometriosis, birth control is an integral component of what is often considered a multi-pronged approach to treating the symptoms of this disease, meaning there's usually 3 or more things happening simultaneously to help treat the symptoms of this disease. And what in the endometriosis circles is considered the gold standard of care is surgical excision. That can be cost prohibitive for a lot of patients. There are a lot of things involved with that because many of the specialists, there's a very small percentage, right, of doctors who specialize in this care. So for many women, they cannot afford to go out of town, rent the hotel rooms, take the time off work, and to go visit a specialist. And a lot of times our care is not covered. So there can be a hefty out-of-pocket cost associated with treating this disease. And I say all of that to say, circling back to birth control was very integral in treating the symptoms of my disease while I was waiting for the option for surgery to become available, not just because there are not a lot of specialists, but the wait time, you can wait anywhere from 12 to 18 months to get an appointment for surgery, right? And that's a long time to be in pain all day, every day, right? And so while it is certainly not a cure, birth control is absolutely, again, integral in helping to manage the symptoms, manage the pain, to interrupt the monthly cycle, because for a lot of us, that's when our symptoms are at its worst, right? And so at the time of my diagnosis, I was newly stepping into the world of entrepreneurship, right, which was very exciting. But also with that, I had lost my previously employer-sponsored health care, which was not so exciting, right? So it's like, how in the world am I going to pay for this treatment? My first surgery, one of many, went very easily into the 6 figures. And so I'm like, how in the world am I going to cover this? And so thankfully, when the Affordable Care Act came along, I was able to get coverage through Medicaid, which I'm still, using today. And thankfully, I was able to get coverage for surgery, and then the birth control is part of like the maintenance, right? But even though I had now had coverage, that doesn't mean that it was without barriers to access, right? Because, some of the payers would look at my diagnosis and it's like, hey, why is this person with no uterus who can't possibly, why in the world would they need birth control, right? And so, there was amendments and appeals that my doctor had to do just to allow me to have access to this medication. And prior to that, a lot of times the scripts for birth control would be for 3 months, 6 months, 9 months at a time, because if you're not aware, sometimes we can bleed for 6 or 9 months at a time, nonstop. And birth control is so important in helping to manage those things. I think, Kimberly, you talked about, sometimes there being barriers to access to the facilities, right? And although now, post-COVID, telehealth and virtual visits are more of a thing. It was not that, when I was in the thick of my diagnosis, my specialist was all the way in Skokie and living on the south side, and an avid public transportation user, that could equate to 6 or 8 hours round trip just to get there and back. Imagine having to do that 2-3 times a week, several times a month, all that time off work, all of those snowballing financial costs, right? And so something just as, I don't want to say as small, but as convenient as birth control, having access to that, it helps to mitigate all of those other snowballing factors and barriers to access. And so, having had that impact and having had that experience was one of the driving reasons that I wanted to become involved with ICAN, why I wanted to become a community advisory board member, because of the important work that they're doing. Because just like a lot of communities on the south sides and the west sides of our city, just like we have food deserts, right? We have medical deserts, we have healthcare deserts, again, going all the way to Skokie, going all the way to Evanston. And so now having ICAN, having these community, partnering with these centers within the communities, so we don't have to have that travel. So we're not paying $25 to $35 per pack. Imagine if you had to go in and you had to get a 9-month supply of birth control and you had to pay $35 per pack up front. Who would be able to do that? I certainly would not have been able to do that, so it is very crucial, the work that we're doing, and I'm glad that, I'm in a state that champions reproductive equity and reproductive access, and I'm glad that we're having, the conversation to not just have the conversation, because the conversations are important, right? But also move beyond the conversations into meaningful, impactful, actionable steps to make this happen, because I think that you cannot have reproductive or healthcare equity without access. And so I'm grateful that, all of the voices in this room, along with ICAN, that we're working even more diligently to make that access happen. And, that's going to help tons of patients, especially the 200 million endometriosis patients that are living with this daily.
Thank you so much. I think you said it eloquently, and thank you for sharing your story with everybody. We only have a few minutes left, but I want to make sure, audience who have some questions, we welcome you to come on up to this microphone. Just please say your name and where you're from. Please feel free to direct their question to any one of us, maybe except Lizzie about Medicaid. Anyone? Great. Dr. Patel, do you want to just come up so we can all hear you? I know.
Since you brought us all together today, how do you all see us working together? Because again, as you said, I don't want to get all excited about today, because I'm excited about today, and then it becomes tomorrow, and then it goes back to normal. So how do we keep it going?
Yeah, I think it's, we're trying to create a world where anyone in Illinois can get their birth control at no or low cost. And what that means is also, working with all of you, whether you're a payer, a policymaker, a provider, or a patient, right? Working with everyone has a role. And I have to say, often working on implementing contraceptive access, it's not sexy. It doesn't make headlines, right? But that's where we're all here committed to say, hey, what can we be doing day to day? How can I be routinely screening people for contraceptive needs and desires? How can I make sure I have devices? So if people say, I want an IUD or implant, I can provide it that day. How can I make sure you have coverage from the get-go? So when you call and you say, I'm not sure I have insurance, you feel reassured that you can go ahead and make that appointment and get your birth control of choice. So I think it's multiple levers, and you're right, it does feel kind of like, we go back to tomorrow, but I hope that we can really change the culture, and with 5 years down the road, we can look back and everyone knows where to go, who to trust, and that they can afford their birth control of choice. Any other questions? Yes, come on up.
Hi, my name is Eleanor. I'm with the Chicago Abortion Fund. I was wanting to ask about HHS. We talked a lot about minor access to contraceptives, and what are we doing to continue to protect minor access to contraceptives, specifically at Title X centers and in our neighboring states. The Chicago Abortion Fund refers people out, supports people in other states, and gives resources and referrals for contraceptives, and I was wondering, what are we doing to protect access? As we know, there is a lawsuit in Texas with Judge Castlemark, and the state of Texas minors there haven't had access to confidential contraceptives for a year now. And so what are we doing to continue to protect those around us in neighboring states who have similar hostile attitudes towards contraceptives and young people access?
Yeah, so good question. I have to be very careful about when I talk about particular states, because they don't just have one lawsuit. There's like many lawsuits, and sometimes just talking about a particular state can land you into a new lawsuit. So appreciate the flag. So I would start with the work that we're doing in the privacy space. We do recognize right now that we really are in a time that HIPAA we just didn't contemplate a time where people would be tracked, where states think they own people, and they're going to track them when they go other places for health care. And honestly, I think our rule will come out, and we will probably get sued. But I think we've written a rule that we think is solid, and we'll continue working on that. And so that will be one protection to help patients, providers, clinicians, people involved in the provision of health care. So I think that's one. Two, it's educating people about the current state of the law, like we talked about permissible disclosures versus what is required. And then three, specific to Title X and other issues, I know there is department work across the HHS to think about referrals within specific federal programs. I know some guidances have come out in that space, and to your point, doing more education is really important. And also thinking specifically the Title X program, we are working with our colleagues in Title X to think more about that. And so we will take that specific flag back. But I know there are many a table of folks thinking about what else needs to be said here to help protect this. And I'm sure you can appreciate sometimes it takes longer to get these things out than we might hope for, but that's because we are very realistic to the place in which we sit, and that there are people who they just don't want women to have access to health care. And so they're doing everything they can to try to stop that. And so we have to be very careful and thoughtful and work with lots and lots of lawyers to make sure that everything we put out is solid and we think the best read of federal law and consistent with federal law. So thank you for that. And I will just say to the earlier question, I love policy. Policy is my love language. And so, you know, we don't have money for commercials or even, I mean, I don't, like the Centers for Medicare and Medicaid Services, they do lots of active enrollment stuff for Medicare, Medicaid, Marketplace, which is the Affordable Care Act, and gosh bless them, right? Like that's really strong work and so important. Other organizations like mine, like OPA, which runs Title X, like we don't have as much funding, and so we really do want to partner and work on community-based organizations, because that's really the only way we're going to get the information out, is working with local and community partners to make sure that folks have information about their rights, folks have information about what is required under the law, and folks know where to go when that doesn't happen right.
I was just gonna add one thing. I want to give a shout out to the Chicago Abortion Fund. We had a meeting with Chicago Abortion Fund back in May where we convened providers in Illinois together with CAF. Minnesota is actually going through something similar right now because Minnesota passed their Reproductive Health Act, and they're surrounded by states that don't have access or have highly restricted access to abortion. And with CAF, we had a meeting with providers on a real practical level because they needed to figure out, hey, do I need to hire more nurses? Do I need to go into more residency programs to get another class of OBGYNs? Do I need to go to a bank and get a loan to expand my clinic? Do I need to expand our footprint? Do we need to look for a bigger building? The practical decisions that going in to be a provider, and CF has been a big partner on that throughout, so thank you.
Also, just a super quick plug, if there are any providers here or folks looking for clinical information, I work with Doctors for America, and we have a pretty comprehensive guide to kind of the legal implications across different states, advocacy resources around privacy, telehealth shield laws, training, for OBGYN training and abortion access. It's a really awesome resource. And also, if you're passionate about this work, please reach out to me, get involved. We're always looking for more advocates as well.
There's also the federal website, reproductiverights.gov, which is not just HHS, it's across the U.S. federal government. It has all the privacy stuff I've talked about, non-discrimination stuff. It has information on Title X, Medicaid. It has information for providers. That's the place where if you can't remember anything I say, that's probably the easiest thing because all the things that I've told you about, a portal to file complaints, guidances, they'll be on that website, and that's an intergovernmental website that's run by the U.S. federal government, including it does have a link to, I think, one page that actually links to state sites that give you information, because we thought it would be helpful to have a federal site that had that site up so that women could find that at a federal site.
Yeah, and I was just going to add to the question earlier about how do we continue this work beyond today. You know, I really appreciate that call in, and ICAN's role is to really provide that statewide coordination, right? Working with providers, payers, policymakers, as well as patients. And so trust Dr. Patel, you will hear from us, but so will everyone in this room, and we really want to invite you to join us. If you are not already partnered with ICAN, please talk to us so that we can engage with you. And I think on the piece of patients, it really is important in closing to acknowledge just how important patient engagement and education is. That's a really big part of what ICAN does. So unlike the federal government, we can do media campaigns. We can invest in reaching out to patients to help them know where to go, who to trust, and ensure that they can afford it. So visit icanforall.org to learn a little bit more. And with that, I want to just wrap us up and say thank you again to Cook County, as well as to HHS for co-hosting this event. Thank you so much to HFS and Lizzie for joining us, as well as our incredible providers and Community Advisory Board members. Thank you all. We will stay for a few more questions if you want to chat with the panelists after this event.